I'm really excited about the whole day's event. Obviously, this morning we had a blue chip kickoff panel of esteemed experts on a wide variety of topics, which was great. As we were thinking about who could complement that in our lunchtime keynote speaker, Sandra jumped to the top of the list because Sandra, as you're going to see, is a very smart, very experienced leader who's very outspoken, and I think we can learn a lot from her. So Sandra Samuels is the president and CEO of the Northside Achievement Zone, what we call NAZ, which is a group in North Minneapolis, a federal promise neighborhood. North Minneapolis, for those of you who are not from Minneapolis, is an economically challenged area. It's been economically challenged for a long time. And she's leading the charge to try to break the cycle of poverty, focusing on kids, getting them ready for college. And she's a real leader in the community, well respected across the community. And I thought it'd be great to learn from Sandra what she's experiencing on the ground, kind of bring our high-level academic discussion back down to reality on what she's seeing every day in the work that she's doing. And so that's why we're here. And we're thrilled, Sandra, to have you here.
Thank you.
And so why don't you join me in welcoming Sandra. Thank you. So I'm going to kick off with just a handful of questions just to level set. And so, oh, by the way, the other thing I told Sandra as we chatted about this is I asked her to pull no punches. I like people to be direct. And I said, Sandra, I want you to be direct with us because I want to maximize what we learn from you. And don't sugarcoat it. We're the Fed. You don't need to be polite. Bill Sprigg said he wanted to burn the place down, but he was happy to be here. So we're happy to have you give it to us straight. So give it to us straight, Sandra. That's my request. So tell us, what is NAZ? What exactly are you trying to accomplish? And what's different about your approach than all these other approaches that have been tried for a long time?
Well, thank you. Thanks, Neil. And I just want to thank all of you for doing this incredible work, that you're actually thinking about the future of our country and what we need to do in our generation to get it right. How many of you have seen Hamilton? Or, all right, some crowds haven't. I get shocked. I clutch my pearls. But so it's kind of fitting that we're here, you know, the father of the treasury, right, and that whole story. But I love that play for me is as beautiful as any chapel or piece of artwork. And but there is one song, a number of songs, but one of them is "History Has Its Eyes on You," and I really take that to heart. I believe history has its eyes on us, and what we do with our time here in this country, our country, to make it better and different for all of its citizens. And so Northside Achievement Zone, we're actually the NAZ Collaborative, we call ourselves. We have 40 partners, nonprofits, and 8 schools. We have really formed this model that replicates the Harlem Children's Zone. How many of you are familiar with the Harlem Children's Zone? Place-based strategy to end multi-generational poverty using education as the lever. And ours is a 2-generation approach. And this community heard about the success of of Central Harlem, this place-based initiative, where 20 years later, under Jeff Canada, Jeff actually had a map in his office of all the places students in Harlem were away at 4-year colleges. He had pegs all around the country and even some international. And so we looked at the success of the Harlem Children's Zone and how it was successful in terms of the lives of students who were historically thought of as uneducable. They had too many adverse childhood experiences. Poverty had a chokehold. They, of course, can't be educated. We can't change this thing. And we were looking across the country at Central Harlem, and we knew that 20 years later that there was a Banana Republic, a juice bars proliferate, an Apple store, and of course President Clinton has his office there now. We saw that the physical infrastructure of the place changed as an investment was made in human capital. And so the question got called here around 7 or 8 years ago. A funder gathered a bunch of nonprofits. In fact, my nonprofit was working on violence prevention in North Minneapolis, and we were kind of teetering towards education transformation because we realized that violence was not a problem, but a symptom of a greater problem, and that if you got to the root, you could actually transform a community. And but we had housing organizations, educators, health, and so on. And the question got called, could we do that kind of place-based strategy in North Minneapolis? And for us, it was imperative. I had been a nonprofit leader for a number of years, working on, again, violence prevention, and it was so cyclical. Some years we were written about in the Star Tribune. Violence had gone down incredibly, and we kind of patted ourselves on the back, and then the next year, violence went back up, you know, a couple years later and so on. But our kids, just in terms of North Minneapolis, okay, just think Newark, New Jersey, Camden, south side of Chicago, I mean, places in Detroit, that same, you know, that same kind of ground zero for disparities. And so anyway, so we said, well, what we've been doing hasn't been working, so let's try this holistic approach and create an infrastructure of opportunity for families. And so, so we started again 7 or 8 years ago, and the first thing we did was work with the University of Minnesota to determine what the place would be. And so I have a little aerial map that we did of North Minneapolis and the surrounding area. And the place that you see kind of highlighted there in the box was what is the zone of North Minneapolis. And North Minneapolis, just to give you context, and it is ground zero for every disparity you can think of in the state of Minnesota, and we have a ton. But North Minneapolis the city of Minneapolis has about 388,000 residents. North Minneapolis has about 63,000. 30% of our neighborhood are made up of children 0 to 18. We have the largest concentration of children than any other neighborhood in Minneapolis, and the worst outcomes academically and for families. So anyway, so we decided on what area of North Minneapolis we would focus. Since then, we have spread out, and now the mantra is, if there's a scholar, we call all our babies scholars because we want to get at the belief gap. If a scholar is in need anywhere in North Minneapolis, especially if they're in one of the schools we're in, because I mentioned 8 schools we're partnered with, parochial, contract alternative, public district, public charter, and then of course we would work with that child. And so anyway, so it's been 7, 8 years. 5 years ago we received a Obama administration Promised Neighborhood grant, $27 million for 5 years. To take this 2-generation approach of working with both families and the scholars to end multi-generational poverty in our lifetime, using education and whole family support as the 2 levers. And so the partners besides the academic partners include career partners, health partners, housing partners, and then education includes early childhood, K through 12, colleges, and after school and summer. And it's been quite a ride to lead this collaborative approach. And the thing that makes us different, I know you were going to ask that at some point, but the thing that I want to tell you about some of our outcomes, because we've had some incredible ones, and I'm very heartened by them. I live in North Minneapolis. I've raised 3 girls there. One just graduated from the school right across the bridge Thursday, so, but at De La Salle High School. And I wouldn't live anywhere else in the city. And I mean, North Minneapolis is home. And my husband and I are living there we are on mission because we want to be a part of the kind of resurgence of our community. And I've never seen such hopefulness in terms of what's happening there on the ground, because what we're doing, and I tell you, so our grant ended in December. So the $27 million is gone, and I'll tell you how we spent it, and it leads itself to the outcomes. But even if we go away tomorrow, I believe that we are innovating the social sector, because families and children don't come in pieces. But too often, researchers, academicians, policymakers, nonprofit leaders like me treat them as if they do, that they can be piecemeal. Go over there for housing, go over there for early childhood, go over there for a job, go over there for furniture or clothing and so on. And oh, by the way, then you'll see your way out of poverty, and they are whole beings. And I think the thing that's made us different, and it's really hard, is that we are starting to work with them as a system. And we've created an infrastructure of opportunity that is driven by data. We have a data system that we all share at the center. We've gone, once we got the grant, from 12 employees to about 75 now. Many of my employees work at our partner locations because we call ourselves e pluribus unum. And so if a family says they have a housing need, our housing partners get pinged in the data system. So then the family doesn't have to go to the housing partner and retell their story again around why they're highly mobile. And by the way, trauma in low-income communities is very real and very palpable. And we actually re-traumatize families when we make them go to all of these nonprofit and government services and retell why they're in that situation. So anyway, so it's a collaborative approach, 2-generation, parents and children, and I'll tell you about the outcomes.
So tell me though, imagine a young couple in North Minneapolis has a baby. Mm-hmm. When and how do you engage with how do you find them? How do you engage with them? What do you do to try to improve the chances of that child having different outcomes?
Yeah, so what we used to do is different than what we do now.
Okay.
So when we first started, like 7 years ago, we just door knocked, because that was something we had a facility for. Many of us lived in the community. And so we would door knock, and our value proposition was, would you like your child to go to college? And by the way, everybody who was door knocking looked like the people who were answering the door. So very much the community is about 49% African American. We have a burgeoning Latino community, large Hmong community, and we let some white folks live there too, like 25%. But anyway, we knocked on door and said that. And the thing is, and this is what I will tell you, and I'm not going to pretend that it's easy, because it's not. And our families are facing a lot of challenges, and there is a continuum of healthiness and dysfunction, just like there is in the general population. But the more money you have, the more you can cover that up. But anyway, you know what I'm saying, right? But anyway, nobody, if they answered the door, said, nah, I don't want, Jamal to go to college. I want him to stand on the corner, pants down to his ankles, be shot at, sell a little weed, shoot. I mean, nobody said that. I mean, everybody said, yeah, I would. And even if they never went to high school, or, completed high school, and then our next question would be, in the parlance of the neighborhood, and could you use someone having your back to make that happen? And what every mother, what every father said was, yeah, I would like that. And that's the thing that we've been doing. And so that we started with door knocking. Today we have about 1,000 families who are in our infrastructure of opportunity, about 2,300 scholars. And so we don't have to door knock anymore. A lot of our schools will refer students. So our thing is, send us your huddled masses. So I've been living in the zone. I don't need the supports of the Northside Achievement Zone. My education gives me that. I'm married. My husband's education gives him that. We've had our middle class breaks. But for the families, the teachers will identify, or some of our partners, and they'll say, if we don't get this child, this family, into our infrastructure of opportunity, he or she's not gonna make it. Like, we're clear, absolutely not gonna make it. And so now it's a lot of referrals. And then the families themselves will tell their cousins and tell people on the block.
So talk about the outcomes. How do you know, because when I traveled around the district, or when I was a candidate in California, I visited lots of nonprofits, and every nonprofit I visited introduced me to people that they'd helped, and it was very heartwarming stories.
Right.
But when you step back and you look at the data, it's very hard to see progress. How do you know you're really making a difference?
Yeah, I always say, Neil, long gone are the days when nonprofits can just parade a couple families in front and have some tears. I do like it when our families cry, though. It does really, especially if there's
good
some
tears,
policy
good
makers.
Tears.
Yeah, good tears of being, but that aside. But you really have to be able to show. So here's the two things around it's working. So we've been at this in earnest, full funded for the last 5 years, and I do have people say, well, how many kids are graduating from high school now? And it's like, how many kids have you ended poverty? And it's like, are you kidding me? Are you serious? I mean, implementation science says it's 5 years before you can see anything that kind of happens. And so for us, I want to talk about results in two ways. One is our successes and our failures, and what we're learning that we can inform the field about what we see work, what doesn't work. You know, I could talk to you about our shared data system. Every community that's looking at this holistic approach, the first thing they talk about is the data system. That is the hardest thing. But we have it going, and we have a model. And but it's right now. I mentioned that we have co-located staff that are like we have family achievement coaches. Those are men and women who are from the community. They work full time. I believe we pay them a handsome salary, and with absolutely great benefits. I thought that was important so that we professionalize working in communities that really are going to fuel our economy of the future for the country. But anyway, the family achievement coaches are in all the schools and things of that nature. And they are actually the ones, the family achievement coaches and the specialists. We have housing specialists, career specialists, behavioral health specialists who are also in our partner locations, who are inputting the data. The dream 5 years ago was that all of our partners would just scrap their data system and we'd all just use that one. Well, that didn't happen, you know, and we're still working on that and a lot of systems things. But where the successes have been, so the challenge is still around the real sharing of data, you know, and we share it enough to know what's working, because our interventions are layered and they're combined. That's the whole thing around having a wraparound and a holistic approach. So what we're finding is that when we have layered combined supports for the same families and same children, when we surround them with the team they need, based on our infrastructure of opportunity, they are performing statistically significantly better academically than kids who are not getting that combined support. So, for example, early childhood. We use something called beginning kindergarten assessment. And 2 years ago, what it showed was that in terms of the last time we were able to collect data, that's another thing. I'll talk about the data. Oh my gosh, because every time a system changed what they use to measure, everything we do changes as well. We have to go back to our baseline completely changes. And so we actually don't have a beginning kindergarten assessment for Minneapolis right now that's uniform, that everybody uses across the board. But anyway, kids who are in the zone, but not in NAS, only 18% were ready for kindergarten, according to our assessment when we did have it. And then if they were in NAS and they had a family achievement coach, 25% were ready. And then if they were in NAS, had a family achievement coach, and their child went to a 4-star rated early learning center, then 35% were ready for kindergarten. But if they were in NAS and they had a family achievement coach and they went to a high quality learning center and their parent graduated from one of our parenting education programs, 50% were ready for kindergarten. And so we keep seeing that and that's what we're seeing around 3rd through 5th grade reading proficiency. The scholars who are in NAS, whose parents are getting support, who are in our after school and summer programming, now not ours, but our partners, they in fact are doing statistically significantly better academically on our MCAs, which are our proficiency assessments. And this is trend data, so this isn't just 1 year snapshot. We're seeing it year after year after year. And so we know that the customized approach works. It absolutely works. And that is the innovation. Because part of the problem is adults really don't know how to play well in a sandbox, right? I mean, we really don't know how to collaborate. Those are skills that you actually have to learn, you know, and it has been, we've been cutting our teeth on how to really collaborate in the zone.
And you're talking about getting the nonprofits to work together?
Oh, yeah. Oh, yeah. It's just, you know, across the board, because we all have our own board of directors, we have our own budgets, we have our own fundraising plan. And as soon as resources always feel scarce. Who's getting too much, who isn't, who's getting the acknowledgement for the outcomes. And the thing about it is, the only way the outcomes are happening is because of the layered support. It's the most amazing thing. You can't, if you extract housing, or you take away the career support, or you take away the parenting education, we wouldn't see the same outcomes we're seeing. And we're seeing more parents get back to work. That is really difficult. I could talk about the workforce industry within low-income communities all day long. And one thing about doing this work that I've learned, but anyway, successes, and I'll tell you about failure. But with the successes, more families are going back to work. We are stabilizing families, and then we're able to track chronic absenteeism based on being able to stabilize the children, and they're not highly mobile. So that is absolutely, we're seeing the chronic absenteeism go down. And again, this is trending data. Parents who graduate from our parenting education classes are achieving twice the goals of parents who do not. Because one of the first things parents do when they come into our infrastructure of opportunity is they create an achievement plan. And that achievement plan becomes our map for which partners they're directed to by their family achievement coach. And so, so while all this is going on and we're creating this infrastructure, we are really cultural creatives. We are another really hard thing is shifting the culture. And it's a culture, we have a belief gap, not just an achievement gap, right? When you have been just perennially poor, and the messages you get, especially if you're low income and African American, are always that you can't do it, you've never done it, you know, just the kids get the messages all the time. The belief that it's not possible is real. And then of course we the adults have that same kind of limiting belief that these kids can't make it because of this. And then our systems are just so jacked up. You know they have this saying that every system gets the outcomes, perfectly gets the outcomes it was designed to get. So, and when I first started, I would always blast the educational system. So that was my thing. Like if we could just get rid of those that teacher union, we would be like, okay, all this other stuff. And I realized that was so naive and simplistic. Because there's a workforce system, there's a housing system, you know, there is an early childhood system, and there's an educational system. There are all of these systems that are broken, that are absolutely designed for people not to get out of poverty, that our families who are most imperiled are totally under the foot of.
So given what you've learned over the past 5 or 6 years and the progress you're making, what are the biggest challenges that you still face today?
Yeah, so, you know, the one that like stumps me all the time is, I mean, like really, we have data coming out the gazoo, right? I mean, I can show you, you can see, now is it working all the way across? No, of course. We don't have kids like wholesale going to college yet. We started building kind of bottom up with our youngest kids and families, and when we started our parenting education, the first thing we did was college-bound babies, a 12-week parenting education program for children 0 to 3, parents who had children 0 to 3. So on, so they learned all about brain development, positive discipline, how to have your child ready for kindergarten on their trek to college, all this other good stuff. So anyway, but where the success is happening, where we see this trend data, we see the trend data, it's real. And but we still have like, you know, one of our leading politicians, I'm not gonna call her name out, but she's really big in the state, said the other day, you know, I really love Northside Achievement Zone, but they're too expensive. So I keep hearing that. And Art Rolnick, and Art is on the board and used to be here at the Federal Reserve, and Art and I are always trying to combat that argument. You know, we hired Wilder Research to do a return on investment study because it was like, that's what business people want to hear. Politicians want to hear, what's the return? For every dollar invested in NAS, it was found that there would be a $6 return. Art likes to do percentage rate, interest rate, so that's like about 14%, right, Art? You got it. Okay, right, which sounds better. I'm going to change my data a little bit there. But anyway, and so the thing of it's too expensive, and so the question becomes, look, I have to like namaste. The question becomes, compared to what? It's too expensive compared to what? So is it more expensive than disproportionately locking up African American young men 15 years later? Is it more expensive than the welfare system we have established and people becoming dependent generationally? Is it more expensive than special education? Is it more expensive than all of the babies we bury every day from inner city violence? And if they're not buried, there's so many young men in wheelchairs in my community who are paralyzed from the waist down. Like, so more expensive than what? You know, and the thing that gets me is that all of our children have genius. Every single one. Now, is everyone equally a genius? No, of course not. We know that, right? But every one of them has genius. And for us as the guardians of our society to say, investing in that one right there, whose only fault is that they were born in a zip code that has poor outcomes for kids, we're not going to invest in them because it just costs too much. But we'll pay quadruple that at the other end when we have to take care of what we didn't take care of on this end. And so that for me has been is the most frustrating thing. And we have data. There are so many research reports. But what I've realized, and this is where you all come in, because I think the thing is you don't give up. You don't stop telling the story. You don't stop collecting data. And I don't blame the woman in higher office who said that. I hold the responsibility for telling the story better, for making the data more relevant, for staying in their faces constantly with it. But I realize that people pick a position, and we see that now in our polarized politics, right? And no matter what you say, they can find a data point to support their point. It's like, you know, we don't listen to each other, we reload. We don't listen, we reload to make our own point. So that's the most frustrating.
So you have in this room some of the best researchers in the world, quite literally, and some watching at home. What should we focus on? What can we do? So the Federal Reserve, we're not a grant-making body. That's the role of Congress. What we can do is we've got monetary policy, which we had some discussion this morning of its limitations and its potential, and we have the ability to do research. What do you think we can do to help you and to help the folks in your community that you're trying to help?
Right. So, well, you know, another song from Hamilton, you remember? Who lives, who dies, who tells your story? Remember that song? But helping us tell the story. And, you know, and Sharon and I were talking about it. So it's, you know, so research is important. And I know that the feds, you all with Rob and Art, you know, one of the things that, a legacy that's here is around the early childhood. And people could hear Federal Reserve professionals talk about the importance of early childhood and the return more than they could a nonprofit leader like me, you know, or people who are just in the field. It was you have a totally different pulpit, right, you know, for getting the word out. So that's one, and that's made a difference. We've gotten some significant funding because we've been able to use that data plus our own to continue making the case. And then there's the applied research, you know, actually, and that's the thing that, you know, you all are smarter than me, so you'll have to figure it out. Like, you know, how do we get that on the ground and into community? So that we can really shake up, you know, the status quo and the way things are right now. I know one of the things that the University of Minnesota has worked on with us is our Family Academy. And, you know, this is granular, but the research around validating that parenting education, actually the interaction between parent and child, is one of the best investments we can make. Was important, is still important to us in terms of making that case. And the U actually went out and got $300,000 to help us validate our curriculum and the work that we were trying to do. The behavioral impact of people believing that it's possible, the social emotional work that we're doing is, you know, there's not a lot of, people are struggling around the social emotional. Like, how do you really measure that? And the thing is, they talk a lot about the kids, but we also need to talk about the parents who are in generational trauma, right? And how do you measure it? How do you know what interventions actually work? Things of that nature. So there's some cutting edge things that people still don't know, can't quite figure out. And then the whole thing around the social determinants of health is everybody throws it out and they talk about it, but measuring it, like in a way that you can tell a story in order to continue your work through funding, through people believing in your work, leaning into it, really becomes critical for us. And for those of us who are on the ground, we can't do it alone. We don't have time, we don't have the resources to make all of that happen.
You know, one of the surprises for me was I feel like as a nation there's a lack of sense of urgency.
Oh yeah,
And-
good moga, as my dad would say.
When I was at Treasury during the financial crisis, I feel like I learned, and we learned, that you break the back of a crisis with overwhelming force,
Right.
not with incremental solutions. And
Right.
that's what Treasury and the Fed did with Congress's help.
Right.
They threw everything they could possibly think of at breaking the back of the financial
Right.
crisis, and it worked. So in March, I gave a provocative speech at a community development conference in Washington, D.C. on education. And it was kind of a call to action, saying it's time to stop messing around if we're really
On the
serious about this.
edges. Right.
I was very surprised at the pushback I got. The pushback I got was not that they didn't like my solutions.
Right.
The pushback was, there's no crisis. What are you talking
Right,
about?
right.
We're on track.
Right.
And I couldn't believe it. And these were
Right.
community professionals, nonprofit leaders, doing this work.
Right,
And if they're the
right,
ones saying
right,
there's no crisis,
right.
wow, we have a lot of work to do to
Right.
open eyes and hearts.
Right. And you know, and Neil, part of that's because it's not their kids.
Absolutely.
Right.
That's exactly right. That was my
right? Yeah, it would be a crisis then. Like,
Yeah.
oh, John's not graduating. Whoa, you know? And that's the thing. If we could get people to see, like, what if this were your child? What if this were your community? Would this be cool? And we'd all have to say no. You know, that's the biggest part of the inequity, is not believing in the inherent abilities of all children. And that to the degree that they're not being born into this level playing field, we the adults can do something about that, regardless of what family they were born into. We can. We set policies, we make budgets that are our moral documents. You know, there is no reason why we can't fix this thing. I mean, I'm convinced. I'm so filled with hope, it's not even funny.
Well, on that great note, why don't we open up to anybody here in the room who would like to ask Sandra some questions? Mike's coming to you.
Okay, softballs, all right? 'Cause I feel
This
like-
is a real softball, not. I'm John Moon with the Federal Reserve Bank of San Francisco, and I just want to applaud the work that you're doing. We know how difficult cross-sector, place-based work
Yeah,
is, and other Federal Reserves have taken on this work too, like the Boston Fed.
Yeah.
The Working Cities Challenge, the San Francisco Fed recently, and a national place-based effort. One of the things that we're dealing with, and in this issue of economic inclusion, is when you work on place, and you talked about Harlem changing with Apple stores,
Yeah.
is the potential for what happens to the people in those places.
Yeah.
So on the economic indicators in Harlem, I'm sure they're going up,
Right.
and education attainment. But that's also because different group of people are now moving into Harlem. And the challenge is, as you make a place better with the factors that make a place, it becomes more
Right.
attractive. So how are you thinking about this issue of displacement and its impact on your people and how you're incorporating that? Because I know Minneapolis is dealing with that with the infrastructure investment in light rail, and certain
Right.
communities are changing right now as we speak.
Yeah, absolutely. Great question. In fact, Jeff Canada, the former CEO of Harlem Children's Zone, will tell you that they have a $100 million budget, 2,000 employees, and 10,000 children is in their footprint. And he said that today, most of those kids, their families, cannot afford to live in Central Harlem any longer. So I am looking at that, and because North Minneapolis is absolutely coming back. Like, I have no doubt about it, and I am going to see it before I, throw daisies up. But anyway, couple things. One is that we're talking about gentrification now, and saying what are the ways. So we do need a little bit more gentrification in North Minneapolis, quite frankly. So it's always this tension, right? None of it, whatsoever, or all of it, and I'm like a middle ground kind of chick. It's like, we need middle class folks who will attract businesses to come to the community, and we need the families who are there to be able to stay there as well. So two things for us is so that's one way you could help, by the way, right? Because there are no answers for that right now. But one of the things is we are working so that our families become the gentry. So that's one. So we're absolutely with the career, with housing, with we pride ourselves on being cultural creatives, of people actually starting to believe it's possible for them, and we are seeing that in our hood. So people becoming the gentry. one of the things we have to work on is that typically in the past, what we've seen in North Minneapolis is when people get to a certain hourly wage, they move. So, right, even when they have, and so there's like all of these things that we have to work on, because then safety is an issue that has to be worked on at the same time and so on. But families becoming the gentry. And then what are the models out there, you know, besides rent control, or in addition to that, that a community that's where we are right now with our hand really at an inflection point, you know, what are some strategies we could utilize so that we don't suffer the same exact fate? And I don't have an answer, but it is something that keeps me up at night.
My name is Philip Jefferson from Swarthmore College, and I want to also applaud you for the great work that you're doing. My question has to do with the families and parents who don't complete your programs. What do you learn from those situations, and are you able to track outcomes for the kids or even the parents of those families that do not stay with you, so to speak? Or do they just fall off the map in terms of your data collection and things of that sort?
Right, yeah, so we have to get more sophisticated. We're really still a nascent organization, because it's been 5 years of being fully funded, and we were scaling the whole time, going from 12 employees to 75, from $1 million budget to an $11 million budget, data system. So we've had this mercurial, you know, turn. So we've been getting our measurements in place. We have a results system that we use constantly where we're measuring everything. We have evaluators. We have an internal evaluation department. But that's how, when we get more sophisticated of being, because right now, if you leave North Minneapolis, not just the zone, but if you leave North Minneapolis, there's no way you're going to benefit from our interventions because it's place-based. And so you are no longer a part of the Northside Achievement Zone. We're not studying the families who leave. We have a lot of families who come back. We don't erase them. Yeah, but I just.
Families who may not leave.
Oh, but just who? Yeah, those two. Yeah, no, we don't. Right. Yeah, we don't right now. We're not like focused on that, but we have to be, because that's the kind of data that we need to be able to show. You know, I mean, we are measuring the families who just aren't in NAS, period. Some of them could have been in and left, but are no longer in. But we haven't differentiated that group. Because in fact, most of our measurements, when I told you the early childhood data, for example, that 18% who weren't in NAS at all, I know that some of them probably were in NAS at some point. And so that is something that we absolutely need to track.
Bob, you have a question? A mic coming to you.
I know North Minneapolis a little bit. My research team was working in North Minneapolis 20 years ago, so I know the challenges that you're facing, and I'm blown away by your story. My question is, there are other places in your Fed district, in Duluth, in Marshall, in southwestern Minnesota, where I've also been and also done research, that don't have the extreme poverty and so on that North Minneapolis has, but that by most people's standards are also in really deep disarray. And so my question is, what advice, notably, those folks don't have the racial strike against them, but they got a lot of the other strikes against them. And so my question is, what advice would you have for them? That is, and it's not just those two places. It's my hometown of Portland, Ohio, and it's a lot of places across the Midwest that are white and yet have the same money, the same problems.
Right, yeah. So, you know, one of the things that is important for us, and I know that's what you all are talking about, like, why reinvent the wheel? One of the things that we want to do is really position ourselves as a replicable model in any community. And so there is a promised neighborhood like us in St. Paul. So I have a partner neighborhood there who are doing similar work. But we're also partnered with Red Wing, they have poverty issues. They have huge poverty issues. We're also partnered with Northfield, and they've been doing a bang-up job. They have a disproportionate group, population of Latino population there. We're also doing St. Cloud, and you know St. Cloud has their issues. And then Northfield, Red Wing, St. Cloud, Austin, Minnesota just joined. So, and when I say just joined, along with St. Paul and us, we have formed something called the Education Partnership Coalition. And we actually have gone as a group of communities across the state of Minnesota to the Capitol. And we are talking about our work, and we're showing our outcomes. We all do cradle to career. It might be different in their community, but it's all around inequity and really creating a more just infrastructure for the children in their locations. And we've been quite successful with the policymakers to date, coming as a statewide coalition, working with a targeted approach from our various communities, learning from each other. Last year, the state invested $2.4 million in our work in North Minneapolis alone, 2.4 in St. Paul, and like 160,000 to some of the greater Minnesota neighborhoods. And we actually want to continue to grow that and continue to learn. Nationally, about 40 communities a year come to North Minneapolis to visit. And we actually have a whole tour system set up now. You know, we have dates, we invite people to come so that they can learn from all of the work that we're doing. So it really is about informing the field and then speaking with a unified voice around the social innovation that is what we're doing, this cradle to career approach.
Fabrizio, or who has the mic? Push it up.
Yeah, it's great. I want to follow up a little bit what Neil said. What's crazy about Minneapolis? You have a neighbor like North Minneapolis and neighbors like few miles away, like Edina, where like, you know, great schools, great families, great investment of kids, so close.
Yeah.
So my question to you is that, what you are doing to get these kids involved? I'm thinking like all these public schools kids, like, you know, the grade schools, that they could really help several role models. And so are you doing something to get the community more involved in that? Because that would be a cheap way, getting volunteers and, you know, if you do anything like that.
You mean from the suburbs to come in?
Yeah.
Yeah, little challenge with that.
What I want to hear about.
Yeah, just a little. You know, this is kind of a crass example, but like Minneapolis, North Minneapolis can't be saved. We don't want to be fixed, right. Not a deficit model at all. But we have some challenges that if we can, what we're trying to do is come up behind the men and women and children who live there and let them see their own efficacy, kind of, you know, be the wind beneath their wings. Because what happens is, and we have had most of the communities you're naming are white and affluent. And usually when they think of a service project, they say, let's go over to North Minneapolis. And they come, and I always say, like, and a lot of them want to come and clean. And so you'll see like all of these white folks in orange jackets. And I like want to go buy a BB gun and just like, no, we'll pick up our own trash. Like really, because it does a psychic disservice to both them and us. And so, but I do know the spirit of what you're talking about. And the closest we are really getting to that is really probably the education partnerships that I just mentioned, because they're doing similar work in their communities. And so our parents have, like, I know the parents in St. Paul and the parents in North Minneapolis came together, but they kind of are working on the same thing. So they see each other as peers and nobody. So yeah, so that's the only thing about that help model can be, and you know, there's a saying that we have is that, you know, no longer is it time for charity, we need solidarity. And so when you move into kind of people with equal footing, and you need support from other places, don't get me wrong. So I get the spirit, but there's a lot of underbelly to.
Hi, Janet Curry. I'm in awe of what you're doing. It's really great. But you were saying, you talked a lot about data and problems with getting data. And since most of us here are researchers, That's what we do, is work
Okay.
with data. So I wanted to ask some questions about what kind of data you have. And more specifically, are you using the administrative data of the state? Like, do
Oh.
you have the state education records? Do you have the state Medicaid records? All of
Yeah, no, we haven't. And so there is a whole, for those of you who are in Minnesota, there's a whole like kind of movement. I can't think of the name of it, where the state is supposed to be sharing more of that data. We were working with Wilder on it. There is an effort. I can't think of what it is, but no, it's not flowing in that kind of way yet. But we are, as a state, working on getting that kind of data from them and it flowing back and forth. Not just our movement. We're considered a promised neighborhood. We also have something called Strive Network, and those are really grass tops people who are working on cradle to career. Ours in Minneapolis is called, and Twin Cities is called Generation Next. And I know they've been working with state folks to try to get that kind of data. But the health data, like in terms of physical well-being of our families, and we are not tracking that yet. And even our behavioral health, the areas of health that we're working in most is behavioral health. And there are a lot of complications to actually getting that kind of data while we're doing the work. But I would not be able to produce a report for you to say this intervention around behavioral health was done with this many, not yet. But that's all where we need to head is as we, again, really fully funded for the last 5 years. And I feel like the next 5 is scaling our results, but also getting what we're tracking right. And I think we've done a lot of that. So we have administrative data from the district, from a lot of our partners. We track our own data. And that's why we can see what interventions are actually working. And because we're tracking so many things, my hope is we'll actually, when we do look at the other areas to track, we'll actually be able to go back and get some more of that data that we already have, but we haven't pulled together too.
David?
Hi, my name is David Wilcox. I'm at the Federal Reserve Board in Washington. First of all, thank you for what you're doing. It's really inspiring to hear stories on the ground. You've described a big complex of factors that make your job either easier or tougher. I wondered if you could provide us with a little sort of evidence through your eyes of just one of those factors, namely the economic environment in which you live. Is the health or weakness of the local economy a big factor for you, an overwhelming factor, just one among many? And I wonder if you could talk a little bit about specific ways in which that plays out in making your job either easier or tougher.
Yeah, absolutely. Getting our families back to work is one of our most challenging problems. And we're working right now with, there are a number of organizations. We got Azelle Jones over there and Dorothy, who's with the Fed. We're working on one initiative, for example, is a number of CEOs from the area. I have been meeting with local CEOs, African American from North Minneapolis, and actually saying, okay, around jobs and around human resources within organizations, what can we do together on the ground in North Minneapolis with a sense of urgency right now? How many, because we have transportation issues of all of the places around the metro area. North Minneapolis will be the last place to get connected to the rest of the area. So poorest system in that way. So we're looking at all of those, but it's a major thing. For my families, the 1,000 that we're working with specifically, 73% make $19,000 or less. And so when we have even tried to hook up with the county is doing, so there are a lot of workforce development things afoot. And the families that we're working with, it's gonna be hard, like we're really, it's a fight to get them ready. So we call it getting ready to be ready. So like having, the empowerment training, social emotional skills, having your GED, a high school diploma, to even get into some of those entry-level jobs is a challenge for us. But a lot of things are happening that are afoot, and we're looking at that with our partners. And that is one of our greatest challenges, is the economic piece.
How much is, I'm Lisa Cook from Michigan State University. How much is financial literacy a part of your curriculum and a part of your training?
Yeah.
Something that I guess for many of us who are economists, we might want to know.
Right. So the neat thing about the collaborative is those are the kind of things that we lean on our partners for. And so we work with a number of workforce development agencies. There are 3 that kind of anchor that strategy, though we work with a number of other ones. And they in-house have financial literacy training happening. Like one organization is called Emerge, which is a workforce development. Another one is called Twin Cities Rise. And so as our parents go to them and work with our career navigators, specialists who are actually co-located at their sites, they get that kind of support when needed. So it's through our partners.
So it's not a part of the central coaching, like the parental coaching, or that is a part of the coaching?
It would be, so when a family creates an achievement plan, they would say, you know, I need a job. Whoever's on a career, not all of our families are on a career track. Some of them, you know, have jobs and they're doing fine or not looking for something different. But those who get on the career track would then have a family achievement coach and a career specialist. And they would start working with one of our career partners. And so then that would definitely become part of what they were working on in terms of their achievement plan, that overall achievement plan I mentioned. And that's something that we track in terms of their outcomes.
Chris?
Hi, Chris Phelan, University of Minnesota. So, my daughter graduated last week there too, knows yours.
Oh, hey.
Which relates to my question. You said one of the obstacles that you thought when you first got in was, if we could just do something about the teachers' unions. How important in your mission are charter schools and parochial schools?
Oh, really important. So so our kids go everywhere in North Minneapolis. And in fact, when we first researched, when we were doing our baseline, we found that between early childhood and K through 12, our kids in the zone were going to 140 different schools. And I didn't even realize there were that many in the state of Minnesota. But, so we made sure we weren't just working with public district schools. So 4 of our schools are public district. We have parochial, contract alternative, public charter. And that mix is really important because our kids are going to all of those schools. And the interesting thing is our K through 8, because our K through 8 strategy is different from our high school strategy. Our K through 8 is a little bit more baked out. The 3 schools that are trending where the students in NAS in those schools are doing statistically significantly better than the kids in the school not in NAS. One is a public district, one is a charter, and one is a Catholic school, which we think is absolutely ironic. And they have similar outcomes that we're very, very hopeful about. And a great leader, they're looking at data with us, and we have a great team on the ground there. And so that we call that our success formula.
I'm going to take this opportunity. Who's resisting you? There must be somebody.
Yeah, oh gosh. So, so I mentioned the policymakers, right? And so it is the more people are hearing from people they really respect that model is too expensive, the more you get pushback.
I see.
You know, and so policymakers, the systems, so one of the things, and again, this is the innovation, is that because we're working across silos, we're all seeing the system flaws, the things that are absolutely in place to keep families mired in poverty. Like you get to see it as you kind of pull back, because we're all looking at data together across housing, across career, and so on and so forth. And systems don't like change. And like some of our funders, so there are a lot of systems change things that we're working on to change. And a lot of our funders are like, well, make that more apparent. Talk to us about the systems change. Well, you can't put in paper, I'm trying to change the county. I mean, while you're trying to work with the county, you come across as arrogant, kind of thing. But we have this whole force of nonprofits that absolutely need to be in a more symbiotic relationship with the county so that they feel as though we're learning together. And we are. I'm not condescending at all, but the other thing, besides scaling our results, besides making sure we are tracking the right measures to tell the story, but that the measures that are really helping families, the other part is really the systems change approach and what we're working on from a policy level, down to how the rule that, if you've expired on your 5-year limit of welfare that we have here, our MFIP, for example, you can still have food stamps. And for many of our families, what we were realizing is it was a disincentive to go back to work, because if they went back to work with their level of education, knowing what their salary would be, if they went back to work, they'd lose their food stamps, and they would actually be making less than working part-time and getting food stamps. That's a system problem.
Right.
And, finding out what happens. I mean, there are so many things that disincentivize people from actually, like they'll do worse off. In our early child care centers, you let a family, if they have a scholarship for their children to go to these 4-star rated centers, you let somebody get a $5 raise, and that might throw them out. And the kids are out. They can take them out in February. So families are like, they have to start making a decision between not having integrity around what they're actually bringing in, and doing right by their family is what it feels like. And so anyway, I could go on. I could tell you for every single piece of system that we're working in. So that's part of it. And the other thing I will say is there is resistance in terms of some of the families. And this gets into, it is for the same reasons many of us make New Year's resolutions and we don't keep them, or we say we're going to start that diet like all the time and we never do. Humans making change is something that we're all still trying to figure out. And it's not as simple to just say, oh yeah, give them a job and they'll all be good. When you've had generational trauma, and so there are just some families where, and we don't give up, we don't throw anybody out, but you have to be willing to lean into the work. We have a young man now that we've been mentoring, used to live across the street from us, who's in NAS, is in Ascension, was doing just great, we thought, family achievement coach. Mom had a housing subsidy from us to stay in the place she was in. I didn't even know that. I didn't want to know that, But anyway, so all the things were lined up, but a lot of behavioral health issues. And so, and she wouldn't go to Summit OIC. She couldn't make it out to work because she was so depressed. And then she doesn't want him in the Catholic school because, you got to be involved and you got to do the whole uniform thing. And then she didn't talk to her family achievement coach about the subsidy that was about to run out. The family achievement coach kept trying. So right now, this little boy we care about so much and his little sister are all in a shelter downtown. And it has everything to do with mom's inability to lean in. And so we're not giving up. We're going to keep, because that's definitely a behavioral health issue. And so you get that as well.
Well, I think we're at our conclusion. So we can continue the discussion. We're going to go downstairs. But join me in thanking Sandra for her work.
Thank you. Neil, there is